Okay. Pledge of allegiance
To the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Deb, if you want to take roll.
Al Tenaglia,
I am here.
Ray Snyder,
present.
Jeff Fogel,
Here.
I'm here. Brian Long,
Here.
Tony Stango,
Here.
and Tim Heath.
Believe he's on vacation.
Okay. Okay.
Okay, now I know for open floor topics, there were emails that were sent in response to the two options the school's going to have. Have all of you guys had a chance to review and look at them?
Yes.
Now, anybody have any questions with them?
Not at this moment.
Okay. Brian, you have anything you wanted to add as a response to any of the letters?
No, nothing. I don't think anything that came in was, out of the ordinary from what we expected to see.
I think Mr. Yarnell posed a question in his. Did you see that one, Brian?
Can everybody see what I'm scrolling through?
Yes, I know. Mrs. Maddie, that first one, she had brought up a good thing with regard to contact tracing.
Yes, right here.
And notification. So we did add something to and you'll see that whenever we get to the agenda portion, but where we would, do our best to notify, families in the event that there was a case that came into the school, or contact tracing the best we can. The only reason we didn't put that in the original plan was because the county no longer contact traces. So that was really who we relied our information on. It will have to be something that's more on an honor system, but we'll do our best. And that's what we would typically do. That's what we had done last year. It was when there were cases and the families did notify us. That's whenever we got the information out. So we'll do our best to inform our families and whatnot. With regard to contact tracing, but they just have to understand that we don't receive that information from the county anymore, because the county does not do that.
Okay.
And I think that was the same question that was addressed from Ms. Pepito, I believe is how you pronounce it.
Yes.
I think it's the same question also about section 5, and it seems that's been addressed, or you will address it in this when we follow up. Is that correct?
Correct.
Okay.
And Tony, what were you with Mr. Yarnell's?
I think Mr. Yarnell posed a question.
To be honest, since that didn't come until later, I did not get to read the ones from.
If you click on it now, you'll see them.
Yeah, I see it now, but I just have not had a chance to review it.
Okay.
So I just.
It seems to be his questions are right in this section.
Yeah, I see it now.
Which I think you just already addressed that, Brian.
Mm-hmm.
Does anyone else have any questions?
And then in the last one, if you want to
think
scroll down a little more,
I think hold on. There we go.
Ian Redford, if you click on the helpful data attachment, he provided a great deal of data.
Hold on a second, because I got to stop sharing and start again. Okay.
What's that doorbell sound? Anybody
Not
else
me.
hear it?
Somebody at your door, at your house.
Hold on a second.
No, I'm hearing it through my microphone.
Tony, that's when somebody
There
else
we go.
enters into the room.
Oh, because I only see our group. I
No.
don't see anyone else.
Hit full screen and you'll see everybody else.
You'll see the participants on the right.
I go back to this because I accidentally clicked off it.
That's it. Yeah.
Hold on.
Oh, okay.
There we go. Now, with bringing this up, Tony, was there a point you were looking to make?
No, I just wanted to make sure everybody got to see this data
Okay.
that was provided. Mr. Redford I'm sure put a
Right.
great deal of effort into it. Just want to make sure everybody saw it.
Anybody have any questions on this? It is a 14-page document.
I read it.
Okay,
I don't know if Mr. Redford's in the meeting or not.
I'm not sure. Stop this for now.
I don't see.
Is there anyone that is on the Zoom or from the public that has anything that they'd want to add or make comment to?
Hey, Al, this is Wayne Yarnell. Can you hear me?
Yes,
Hey, I'm sorry to bug you again for a response to my question, but I did.
no bug.
I missed Brian's response early on there. If you said Brian had already answered my question, I missed that. I must
I
have.
guess, Brian, if you want to repeat what you had mentioned with that section 5.
Well, was it
Hold on.
related to the contact tracing, Mr. Yarnell?
No.
Oh, okay.
Yeah, mine was more around that specific bullet point that was called out in Plan A, but it wasn't present in that same. It wasn't presented in that same way in Plan B.
Right.
I'm
Well,
kind of,
that would have been if, in Plan A, if there's an option, then we would, as a school, want to know that the parent was wishing to, have their child, follow that option, whether to have a mask on or not. And we just wanted to have that for a couple of reasons. One would have been to just make sure that it's whatever the parents are wishing, that we're enforcing that. Sometimes, kids will come to school and they'll say, oh no, my mom said this or my dad said this. We just wanted to have sort of a, something to document that the parents' wishes were being followed. And so that's why it was there. In option B, it's the, it's a mandatory mask policy where this wouldn't follow suit to be in that plan.
no, that totally makes sense. I appreciate that. And that, yeah. The second part of that question was around the philosophical and religious discrimination piece. And it seems like there's an opportunity for a medical exemption under Plan B, but not philosophical or religious. And I'm just curious.
It was medical or religious or philosophical. And it really, we were just trying to put in there, it's the same case with vaccinations. Kids, they say that all children need to be vaccinated to attend school. However, the caveat is if you have a religious, a philosophical, or some other medical rationale or reason that you do not need the, you don't need to follow that guide or that, and that's sort of the language of the lingo that we were trying to emulate.
Okay, and I was just looking for clarification that those avenues would be available no matter the decision tonight.
I don't believe so. The avenues would be, the medical would always be there if there were a situation, and that was just like last year, the medical would have been there. You would have to follow the IDE plans. There would have to be documentation or a 504 plan that would specify, from a doctor or whatnot, that a mask, could not be worn by a child for whatever medical need or rationale. And then, the recommendation would be to wear a face shield or something of that nature.
Okay, no, that's clear. So there is a distinction between the two. That was really what I was trying to understand.
Yes, correct.
Okay, thank you.
You're welcome.
Okay, so that clarify everything for you, Wayne?
Yes, it did. Thanks, Al.
Okay, you're welcome. Anyone else before we move off of public comment?
Hi, I just have a quick question about attendance. So let's say, Tiffany Hagley, Aiden and Ethan Hagley's mom. I was just wondering, in the case that, let's say, someone in my home contracts COVID-19 and I decide to keep my children home because they're asymptomatic or whatever, is there a point where they would be missing too much school or it would be an issue? Because my fear would be, let's say I did that and then 6 months later, my husband contracted it and I decided to keep them home because I wouldn't want them to spread it. Is that being waived at all this year?
Would you like me to answer?
Falls under your purview, Mr. Long.
Yes.
Okay. Yeah, we would follow, there is a formula that's out there where the possibility would present itself where too many absences were occurring, but they would be excused absences. And so there's a lot of leadway with excused absences, and that would be applicable for excused absences. In the event, we do not have a virtual platform this year, so in the event that there were an extended leave, we would do our best to, get work to the student, to have, opportunities for the student to follow up somewhat with what's going on in the classroom. So we would work on a case-by-case scenario with that in the event that something of that nature were to occur.
Wonderful. Thank you so much for answering that question.
You're welcome.
Okay. Anyone else? All right, then, moving on back to the agenda. Approval of the minutes of the business meeting of June 30th. Someone want to make a motion?
I'll motion.
Okay,
I'll second.
all right. Any discussion on that? All right, all those in favor?
Aye.
All right,
Aye.
unanimous. Now we'll move on to administrative report. Hold on 1 second here. Let's bring up the other screen again. Okay.
All right, so I'll just go through the administrative report. Really, it has to do with the plans, and we said that we would get this information to you. A lot of changes recently took place, particularly with Bucks County. When this was first being discussed, maybe a week and a half, 2 weeks ago, there were discrepancies just in, we had certain health officials recommending one plan of attack with regard to masking, and then another recommending something else. That has changed recently. If you go down to the Bucks County mask recommendation, no, that's up there. It's number 4.
Okay.
But he did receive some information with the local hospitals, and they sort of informed him that if there were large numbers of students needing to be in ICU care, that the county hospitals wouldn't be able to absorb that load. And so he did change his recommendation, David Damsker, to require masking for all students and staff, regardless of vaccination status. So really now you're having the recommendation from all entities, the CDC, PA, PDE, Bucks County. I know that a lot of other schools are now moving toward the requiring mandatory mask policies. Pennsbury just had their meeting the other night, and they did approve masking for all students, and I believe Ms. Shammy is in the process of, and I'm not sure about Council Rock just yet. We wanted to also get you our survey. If you can see number 8 there, you can see that there's roughly about 85% of our families who took the survey, with 63% voting for a mandatory mask policy, with 30% opting for the option to wear a mask or not. And with regard to our staffs, 85% took, 70% favored Plan B, which is the mandatory mask policy, as opposed to 22% who feel the option should be up to the individual. And so that's the information that we wanted to give all of you whenever you get to the point where you make the decision for the school.
There's actually a typo. The family survey was actually 65% in favor.
Yeah, I saw
I
that.
typed 63.
I
but
couldn't see it. Yeah, I couldn't.
See it in the circle though. All
Yes.
right. All right, thanks, Bri.
You're welcome.
Back to the agenda. Okay. No old business at hand, and obviously at this point, it would be more so reviewing and approving either Plan A or Plan B for the upcoming school year.
Could we first approve, could you scroll back? Could you make, there's a motion A to approve the minutes.
We did that.
Oh, you did? Okay. I'm
Yeah,
sorry.
we did that.
My bad.
That's okay. So at this point, we know that we have two options here, Plan A and Plan B, without reading through each one, where one is obviously making a recommendation and the other one mandatory. At this point, it would be a motion or discussion.
I'll motion.
Okay,
It's your motion.
What is the motion?
For approval of the plan.
for the approval of the plan, and then I guess at that,
Which plan, A or B?
So we have to do it for, then we'll go for the discussion, then we vote.
Well, you have to indicate which plan you want a motion for, A or B.
I'm going to vote, well, since I opened the door here, I'm voting for Plan B based upon the data
Okay.
that Brian and the team.
okay. And bring this up. Anyone want to second the motion? Or have a difference of opinion?
I'll second the motion.
Okay. And then at this point, then discussion. I guess then, although,
I
go ahead,
have something.
go ahead.
Under the bullet point, committing to revisiting the mask covering policy as needed, guided by the recommendations of local state departments and health. We all see that bullet point, and I don't have to read the whole thing, right?
Mm-hmm.
As needed, I think we need to clarify. I think we nailed that down. No longer than 1 month, on a weekly basis. I think we need to stay on top of this issue in a very big way.
My recommendation would be to approve this at least for the first marking period.
I understand administratively that would be probably significantly smoother. I think that given the fluidity and the of this issue and the cases and I'll be honest with you, the dearth of fact-based data that is interpreted one way or another, depending on how you feel, I think we need to be looking at this on a weekly basis. With the goal of doing away with masking requirements. I think we need to get back to normal. I know that things are not normal. I think we need to be on top of it, not marking periods, not, you know, at a minimum on a monthly basis. I think we should be revisiting this issue. See what
anything less than a monthly would be difficult because we'd be having new board meetings, like emergency board meetings, if you want to do it weekly. But I think you could revisit it
emergency
monthly.
times, Anthony.
What's that?
Yeah. Emergency times.
Yeah.
When is
Yeah.
the marking period over?
What, Deb, you cut out.
When is the first marking period over?
I believe November 1st.
So that would be the better part of about a little over 2 months. If it's checked by marking period.
Well, we have a board meeting. When is the October board meeting? The 20th or 27th?
I think it would be what, the 20th?
I could look it up.
I'd have to look it up.
Is it the 3rd or 4th? I think it's
It's the fourth.
It's usually the
Wednesday.
fourth
Whatever the
Wednesday.
fourth one is.
So
Yeah,
it's the
so
7th. So can we add on to that?
It is the 27th, not to interrupt.
For that, to do another, to look at it for the October board meeting, going into the second marking period.
It's Jeff's motion right now, so if he wants to make that specification, he can.
Just to interject here, I think, so as needed, I understand why Ray wants to nail it down a little bit, but the second part of that sentence is guided by recommendations of local and state departments of health, correct? And that's the guidance by which we're following. So if they make any changes, I'm assuming if the local and state Department of Health make any type of adjustments, we would be evaluating them or apply them to our cause, correct? Is that correct?
I would think so, yeah.
Right, so is as needed, that, I understand where Ray's coming from on that one, but if we're following the guidelines that have been provided by the state health organization, we just could probably make a some type of adjustment to this sentence to say when and if local and state departments of health, et cetera, make adjustments, we will convene. Ray, will that?
State Department or the Bucks County Department of Health reversed their position within 2 days last week.
Right, well, that's what, so that would be,
That's why this is a very fluid issue. Not an epidemiologist. I think they're kicking the can down here. And I philosophically disagree with that. They're not contact tracing, and yet they're recommending or requiring that we do contact tracing. And we go back to earlier to what Brian said about, well, we're kind of going to have to be on our honor system during a public comment session. I think that we need to stay on top of this issue. If the cases dramatically drop, if someone looks at, I read a Wall Street Journal article today on, not on masking, it was on vaccinating children, and some pretty important people, Johns Hopkins being one of them, were cited in a Wall Street Journal article saying, the data does not support this. So,
okay.
And if you can hear my frustration, it is certainly there. When are we going to interpret their data that is based on fact and not emotion, or based on not based on opinion, which is not fact? I resent being put in this position. I do. I resent being put in this position, but on philosophical and perhaps for emotional reasons. I don't know how else to say it. I think that we need to visit this on a regular basis. If these cases drop off, if new data comes out, if someone comes up with a bulletproof vaccine that does not put children at risk, or has been, really, I think that anything can happen. And I think that the last year and a half has kind of proved that, but since the Bucks County Board of Health reversed their position 2 days last week, that was clearly driven by data that they were receiving. Okay. And while the lesson there for me is that we need to have this kind of built-in flexibility. If there is a big change in the numbers, or the data is somehow disputed and found to be misrepresented, we need to be on top of it. If this is not necessary to mask up all these kids, then let's make sure that it is in fact the right decision. How do we do that? I think by being on top of it and meeting on a regular basis. Look, we moved this meeting to Monday from the schedule on Wednesday. We're all here able to attend, and this is a single agenda meeting besides approving the minutes. All the other administrative things that we need to do, right? Approving bills, staff contracts or none of that's here. So there's no reason why we can't put this together and do this again on a very, very short-term basis. My recommendation is that it go no longer than 1 month. I know that's an administrative problem. I know that the buses, and most of our buses are coming in from Pennsbury. Is that correct?
Yes.
Yes,
Yeah. And I know that you have to have a mask on the bus.
yes.
That's mandated, right? That's
So,
mandated.
right, so you think it's greater than as needed? That's too vague. What language will make you feel comfortable? And that's feasible for,
Once a week, no greater than once a month. I'd like to hear from Brian and Tony, since they are our administrators, hands-on day-to-day in the school. Is it feasible to drop this policy?
Well,
If we vote for Plan B in this motion, is it feasible that we are able to revise or drop this policy as quickly as we are instituting it?
And I'll interject there. I believe that the language is in there that I know I get the semantics with the as needed component, and I'm with you, Ray, but that the way that it's written is that we would follow suit. We would look at recommendations. We would look at different data. We would look at any kind of changes that would take place, and we would act accordingly. And acting accordingly would be as needed if we heard from, a health official or from a CDC or from a whoever. We would be able to act within, a day's time, an hour's time, a week's time, whatever that would be. But we would want to act as, if you're saying as needed and immediately thereafter, something of that nature might be what you're looking for.
Yeah, if we had a meeting today and next week there is data or something that would prompt Brian or I to want board approval to change whatever you do today, then we would seek that approval and seek it quickly.
Okay.
Before you vote, I noticed in the chat section, there's 2 things there. I don't know if you want to.
The third one just popped up.
Yeah, before we go to the chat, there's one thing I'd like to also recommend, Brian, and I know we're in a discussion about approving this, and Tony's, tell me how you want to handle this, or Al, but we've got 29, 30, now 31 participants. That has grown since we started this conversation. It started about 8 when Brian started addressing. Now, I think it's worthwhile because there are some of those participants probably have put comments in that probably didn't hear Brian's responses to addressing section 5 and how we've changed that. Should we address that now, or should we address it after we close this?
I think it's addressed in the motion, and if you look under Plan A and Plan B.
Yeah, if you can just scroll down, so anybody that has joined since a little past the start time could see that how we changed, or I should say I'm speaking French, how Brian changed Brian and Tony changed the language to address the contact tracing, as well as a student coming to school when a student, one of their family members is at home, has it. So I think that has been addressed.
Yes.
I'll highlight that. If you could scroll down just a little bit so that
for both plans.
For both plans, this has been addressed.
Yes.
Mm-hmm. Yeah, either plan would address that.
You got Plan A,
right?
And then it's kind of tough to have them both on at the same time.
Yeah, just scroll down under Plan B.
Okay. Plan B with section 5.
It says
I
for
got
both
you.
plans.
Sorry about that. Now, I thought you were asking to look at it.
So section 5 is being section 5 to eliminate that which is highlighted in yellow on both plans and replace it with BCMCS will follow the most up-to-date guidance from the CDC. Contact tracing will be conducted at the school with mitigation, quarantining, and school community notification efforts conducted in conjunction with Bucks County Health Department guidance and recommendations.
Thank you, Tony.
Okay.
Okay, so where are we at in the discussion? Are we
So
changing as
the
needed?
motion you made still
Yes.
gives Brian and I the freedom to approach the board and say, we want to make a change of policy. Can we have a special meeting?
Okay,
And then it was where Ray was looking for maybe a specific time, a week, no longer than 30 days, but then
I think
Brian.
it's when applicable, right? If Brian and I are keeping track of the data
Oh,
daily,
absolutely. And
daily,
I think
sometimes hourly.
right. And I think what Ray's, more or less looking for is that we will respond, in a quick manner.
In a swift manner,
And that's, absolutely. I mean, add something of that nature, but we would do that regardless. We've always, tried to make sure that we,
Same reason
we're
we called the
responsive.
meeting today rather than waiting
Right.
until Wednesday.
Once a week. Once a week.
Yeah, we'll keep you
Sorry.
posted.
I mean, I can't, you know what I mean? Once a week. There is so much other data out there that and also opinions. It's impossible to read someone's, reference to data without them infusing their opinion in it.
If you're asking
I gotta
Brian,
tell you, man, I gotta tell you, this, if I'm to vote for Plan B, I'm going to insist that we have our eye on the fact that we want to get these masks off.
Sure.
I
agreed.
Brian and I could give you weekly updates on everything. That's not a problem.
That would be wonderful. That would be wonderful. There's already a whole plethora of data out there, and
Right.
Okay, it is very, very much against masking these kids. We're kindergarten to 6th grade. There's even more opinions about how absolutely unnecessary and fraudulent this is. I get that that's opinion based on emotion. I get all that. Maybe a pound of prevention is worth 500 pounds of cure, Mr. Long.
Or even an ounce.
That's what I told him. The ounce of prevention, pound of cure.
But yeah, I think if we could revise the motion that eliminates the as needed, because I'm going to be as needed like on a weekly basis.
You could say as needed and reviewed by administration on a weekly basis.
Yeah.
Or reviewed and updated.
Well, I think the good thing with both, Ray, is it covers either sooner or worst case scenario, a week.
I really want to get it on the record, okay, that we have a goal to get these masks off. That's what I really want to get on the record. We're going to have to wear them on the buses if they're getting bussed in. They're going to have to wear them. Okay. I think that it is. I think it's important that we're on top of this in a very, very meaningful way, and I think our language should reflect that in our motion. Okay. So, Jeff, since you made the motion, if you want to amend your motion, or we can drop your motion and create a new motion here,
I'd rather amend the motion if we're just tweaking language to add language around the time frame that you would like that'll make you feel comfortable, right?
I don't
So
know. Making me feel
Deb, were you capturing some of that?
was the best words, Jeff, because this ain't about me making me feel comfortable. Hell, I'm 61 years old.
There's a lot of comments being posted on the chat thing.
Yeah,
Right.
one of the problems. That's one of the problems because now we are out of the rules of order here.
I know. I just want to bring it to your
So if we
attention.
visit these comments, now we're going.
Well, obviously we can't at this time since public comments closed.
Then we can.
But I just want to bring it to your attention in case you want to read it.
So,
I'm sure you'll see it.
you know, there's,
So let's go back. So Ray, what's the language that you feel comfortable with? So we can get this motion either moved off or moved
I
on.
think I made that clear on a weekly basis.
And
Okay.
what bullet,
That's the language I feel would feel most
Okay.
what bullet point is that?
no more than a no more.
Last, it's the last bullet point. The school commits to revisiting its mask/face covering policy as needed,
Right,
guided by the recommendation of the local and state Department of Health and in conjunction with the most recent data. In addition, if directed to do so by the Bucks County Health Department, the school reserves the right to further add to its masking policy if incidents or positivity rates rise to a level that requires such measure. Any and all decisions will be made in consultation with the Bucks County Health Department, BCHD. So as commits to revisiting its mask face covering policy in a frequency of 1 week, guided by the recommendations of the local and state governments. Is that satisfactory?
That's the kind of language.
Okay.
That's the kind of language. Tony, will you be amending this motion in so you can nail that?
If you give me the wording, yeah.
I just did. So the school commits to revisiting its mask/face covering policy on a weekly basis. Remove as needed and replace with on a weekly basis.
On a weekly basis.
Okay,
Now, if you-
replace as needed with weekly basis.
Yes,
Replace as needed with on a weekly basis. Okay.
Okay.
And
Any other
where do you
changes?
want the weekly basis? Is where I want to get some clarification. Are Brian and I reporting to you weekly with any changes or updates, or is the board, if they come across something that they want to revisit this, calling for a special meeting? How do you want to handle
Well, I
this?
think in the past, we filed the guidance of the state and local health board plus our host district, did we not? Last year?
Yes. So if we see any changes occurring, I mean, we might update you more than once a week. It might be Tuesday where something happens, and then Friday it changes. So anytime Brian and I see something that could sway a change, we're going to notify you.
Well, I think that's what we'll have to be on alert
And
for.
at least on a weekly basis, you'll get communication from us saying this is what's here. There's either been no changes or there has been changes.
Well, I think we also have to be careful because, again, a lot of the parents and the families that are of our school children, there are adjustments that need to be made, especially in the lower L kids, right? So I think we need maybe a summary at the end of the week for us if there's been a lot of changes, so that we can then, enact something if we have to, and if there's some change that needs to take place the following week.
Right.
We have to prepare the student. We have to prepare the families for that.
Oh yeah. If we saw something that would instigate need for this to be revisited,
right,
I would think Brian and I would notify you, and then as a board you would say, okay, we want to have a meeting next Tuesday. We notify the public that there's going to be a meeting next Tuesday to entertain this topic, have a public meeting. The public is invited to it. They can post their comments.
May I interject?
That and data. We would get you data just like we got you data tonight. I mean, that's what we're looking at.
Yeah, I think for the time, for right now, I just brought up these chats. Apparently, a message got this meeting starting at 6:20.
No,
that was.
No, it was.
I just looked at the chat. Some people joined the meeting late after public comment was closed.
Yeah.
I make a motion that we table Jeff's motion here and reopen public comment.
I'll second.
Okay. All those in favor?
Aye.
It's unanimous.
All right. So, Howard, if you can announce to everyone that has joined in here that public comment has reopened.
Right.
And Speaking time is, are we dividing this up by the number of people who wish to speak?
I would recommend a 2.5 minute.
Well,
we would have to keep it to a 2.5 minute time limit.
Why don't we ask them to put their name in the chat if they want to comment?
It won't be in chat. It would be live.
No, I know, but
No,
if
it will be live, but they'll announce themselves via chat first. Who wants to speak is what Debbie's saying.
You already got, okay.
All right. I mean, we've all reviewed the data. So I don't think that we should be looking at this through the chat. I think that we open public comment.
Yeah, I understand.
Okay.
All right, so we can make that happen. Do we need help, technology, or I don't know?
I just want to know their names so you can call on them.
I would agree.
And they've started.
All right. Is there an order? Let's see what we have here. I do know that there's a Young Mi Kim. If we want to start,
why don't we just have a person speak up and just say, I'd like to speak up?
Well, they're muted.
We'd have to unmute everybody, Tone.
Oh, they're all muted right now?
This
Yes.
way they're not all calling out, and you can call on the ones that want to speak.
Let me ask Jason to unmute everything.
Why don't we just put them on video and have them raise their hand?
Yeah, that's what I was thinking.
Right.
I'm asking Jason to unmute the public.
Okay.
I could unmute microphones if you need.
Okay. Well, I guess how we'd start, is we can do it by one of the things that we mentioned, like a show of hands, and then pick each individual as we go.
Can you see everybody?
I see only one person, Ian. Everybody else, the screens are black.
Slide it to the left and they all come up.
I know. I'm going left and right, and other than Ian and us as a board and you, Deb, everybody on my screen's black. Just the name.
I would suggest just the people that wrote their name in the chat that they would like to speak, just call on them and give them 2.5 minutes.
Well, let's see. We have a Young Mi Kim. If you wish to speak.
Hello.
Hi.
Good evening.
Good evening.
Yeah, I'm a little bit concerned. I understand that there's a lot of back and forth about masking, and, you know, we have a lot of different recommendations, CDC, American Academy of Pediatrics, now the Bucks County Health. And there has been a survey, like you said, 85% of the families that attend the school with children there, they said 65% of the parents are asking for Plan B, masks mandated. What I'm wondering, and I guess I'm requesting, is that the board would consider keeping the masks mandatory until the CDC releases the vaccination for children under 12. The reason for that is because yes, I understand children may not be getting as sick as adults could. However, as everyone knows, we don't live on an island. We have family members who may be immunocompromised, who may have cancer, who have elderly in their homes. So, and the vaccinations have proven that there could be breakthrough cases. So, just to be extra cautious, I don't think that it's too much to ask for it to be considered to keep the masks on until vaccination is available. If not, I know this is a big ask, but I would like my children to remain virtual until vaccination is available. I know that that's not something that is being offered at this time. It was offered last year. My children did excellent. All of them, the teachers went above and beyond, and we were more than thankful and grateful for their efforts. And my children did not fall behind. I know there's some children that need extra help. Yeah, absolutely, I understand that. But I stay home. My husband's working from home. We're both vaccinated. My 12-year-old is also vaccinated. We have 2 other children, and we have elderly parents. So we need another option. And that's just what I'm bringing up.
Okay. No, thank you. I do know, Young, that we were gravitating towards the Plan B from the motion that Jeff made. It was Ray wanted better clarification on how the testing was, or follow-up, I should say, what updates was going to be done. He just felt the wording to be too vague or too wide open. So,
right. I'm just more concerned that if it's something that, is going to be revised on a weekly basis, I don't think my children could attend if from one week to another that they need to remove masking, just for the sole reason of, what our family dynamics are, who lives in our household, what our health conditions are. Do you know what I mean? So that was my concern, that I would prefer as a parent for it to be a more solid, concrete option of, okay, until vaccines are available. Now, I understand it might not be a popular decision, but then I would like another option then. If my children could remain virtual, that would be great. That's all.
Okay.
Thank you.
Thank you.
All right. You're welcome. Thank you. I see here, Janine, do you wish to speak?
Yes, thank you so much. Hi, everybody. I just wanted to clarify the point because, as it was stated here, first of all, thank you so much for reopening this. As a family community, BCMCS, we were asked to sign on at 6:20. So we may have missed some points, and I know there was one that was pretty important to me. That being the contact tracing / quarantine. So just to reiterate, if you can, I know we kind of rebriefed it a bit scrolling through, but will we be doing contact tracing? So for instance, I have a first grader. If someone in his classroom, be it a student or staff, is positive, will we be alerted as a school community of a positive case at BCMCS?
Yes, if we receive, yes, and if we receive that information, but I don't know if you got the part that the Bucks County Department does not handle contact tracing anymore. So, a lot of this is going to have to be, based on the honor system. And, there may be families that send their kids in that have a family member that has it. We wouldn't know that situation. And so that's just what has to be recognized with all this. But by all means, when we were, if we were the ones who, did the testing, or if the parents, came forward, or the staff member came forward, we would notify.
Okay, wonderful. Thank you. And as long, it's peace of mind for me personally, that we encourage families to let us know, because there's a domino effect here. As we've heard from our parent before, we don't know the family dynamics and situation that, for instance, if my son, who's unvaccinated because he can't be yet, he's under the age, came home, possibly spread it to us. And I am hearing of all these breakthrough cases. I know vaccinated people who are getting sick. So I know it's likely I can be, even though I am vaccinated. I would maybe need to make my own plans based on that. So I appreciate you addressing that and changing the verbiage there to address it. So thank you, everybody. And you.
You're welcome.
Thanks.
Thank you.
I guess another name in the chat, Brian Carpenter.
Hi, thank you. I'm questioning this a little bit because you're having this meeting virtually. Why we aren't having this like in Brian's office, for example, all of us unmasked discussing these topics. There's a reason you're doing that. And that's, you think about this, you're talking about just one meeting for you guys, that you're asking these teachers and these students to do that every single day on there. And there doesn't seem to be it doesn't seem to make sense that you want to protect yourselves and the parents there by not having that meeting together, but yet you're willing to put these kids and the teachers at that risk. I don't understand what the concern is about having these children wear masks. You're making a decision for them about their safety and their family's safety. Is there is there a reasoning for that? Why the rush to want to do this weekly? It's not going to change weekly like that. As we saw, if anything changes weekly, if you look at the numbers, it goes bad. It doesn't get better weekly.
Thank you.
Is there an answer? That's all I'm asking.
Well,
I've spent 32 years working in infectious diseases and immuno-oncology. I'm just trying to get an understanding for it because, even at my job now, we currently are masked all the time. We sit 6 feet apart from one another, and the majority of our staff is vaccinated.
So is your question why we're not in person, Brian, or what is your?
That's part of the question. Why are you in person and not in person, and why are you rushing? I guess it's two parts maybe. Really, why are you not in person, and why are we rushing that you want to do this on a weekly basis when there's no necessity for it?
Well, part of the reason of not being in person for this one is the move of the date, but there was discussion about us starting to be in person with the September board meeting. I don't know if you heard that portion or not. And I don't think it's so much Russian weekly as where Ray just wants our school and the parent community where we're staying on top of what's happening more than rushing to have a weekly answer.
I'm not sure I'm following that you're wanting to evaluate this on a weekly basis, right? Is that what you're saying?
Ray, do you want to add anything?
I think my point was clearly made.
Right.
If you're asking me to reiterate, I think that because the data and information changed in 2 days last week from the Bucks County Department of Health, I think that we also need to be right on top of this. My point of contention with the motion, and I asked for it to be amended, that we revisit this on a weekly basis or no longer than a monthly basis, with the goal that if data is not being supported, that masks are necessary, that we can either switch to option B or we can remain or increase, like the motion states, if the positivity rates continue to increase. There's a chance that they can also decrease. As you recall, at the close of last school year, we were one of the first schools to go back live with that option, and mask mandates went away. We were not in the position to accommodate that as a point of order until the next board meeting.
Right.
And we were not able to make that transition so quick. There's only 2 weeks left of school.
What would have been the benefit of canceling it early?
Removed the mask mandate, and now there's been an uptick, and now there's a variant, and there's many other variants apparently. So, my point is that we remain as flexible and as on top of this issue as possible, because we can't ignore the fact that this is a volatile issue with strong opinions on both sides. So I would like, as I said before, that it be in the record that we are very much interested in protecting everyone's well-being on both sides of this issue.
I would totally agree with that. Just one little clarification. You're saying that you want to base this on the data. Just which set of data are you wanting to do? Because I know the CDC a while ago was saying that this was the recommendation. This is months ago.
That's the question. That is the question
Right.
of the day. That is the question of the day, and thank you for bringing it up. I really don't have an answer because I get opinionated, littered data and interpretation all over the place.
I totally agree with you in that aspect.
It's driving me absolutely crazy. Another point is that the CDC, in my opinion, the Bucks County Department of Health, the Pennsylvania Department of Health is kicking the can. They're kicking the can down the road here.
Right.
Bucks County is going to have to start doing contact tracing again. They don't want to. It might not be in their budget now. They probably just approved. I don't know.
Probably very likely.
Little hyperbole, you know?
I mean, this should be a PDE decision, not a.
It should be a PDE decision.
Right.
And their data is based on the Center for Disease Control.
I am going to pass. I think I probably went over my time, so I don't want to eat up everybody else's time.
Thank you,
Time
Brian.
too.
No, thank you though, Brian.
Well, listen, I want to make one clarification. I think we had a clear path to, are we not following local and state Department of Health plus in conjunction with the Bucks County
Yes.
Health Department?
Yes.
Right. So it's not we're not taking all information. We're taking those three governing, whatever the bodies, and we're looking at that data. That's what we're looking at. We're not just taking every article and every piece of data that's coming through the door. We're looking at those two bodies as our guiding, plus, I'm sorry, which is not in here, maybe put in here, Pennsbury School District.
And that's why I put in the original motion as needed, because if one of those would flip or change, we would of course notify you, and the board could call a special meeting at any time.
Right. So I just want to make sure we're not just, we're not leaving it an open-ended question here. We're just taking data from everywhere. There's three governing bodies plus our host district that we're taking data from to make our decisions. Isn't that correct?
Correct. And like I said, if any of those were to change,
right, then you know.
Then you would decide whether it warranted for us to change. But if everything is consistent and everybody's keeping the mask policy in place, there'd be no data to prompt a change, right?
Correct. Got it. Okay. Sorry.
Okay. That's okay. All right. I see Wayne Yarnell. Wayne, is there something you want to add again?
Yeah, well, I just wanted to clarify a couple of things. So
Okay.
I think, Ray, you brought up a good point about the data. So, I mean, if you look at what the Bucks County Health Department just said after all summer long and up until 2 weeks ago, it was mask optional, right? And then they came back at the 11th hour just before school started and they changed it to recommending masks be required. The data hasn't changed. What changed was hospital administrators coming to Damsker and pressuring him to make a change, right?
Absolutely.
And the hospital administrators, and if you read the specifics of their recommendation, are saying that they are seeing an uptick in non-COVID related illnesses. So this is not about COVID, non-COVID related illnesses now. And if there were to be an uptick in COVID, they would then feel the pressure due to staffing issues, et cetera. So, I mean, I guess it's just frustrating because, we can be as safe and mitigate for every possible scenario here, but it's not like at some point, if this is going to end, it's got to end with people making decisions. And you're exactly right. All of these entities are punting to the lowest or the localist common denominator. And they're essentially, you guys are now, and gals are now responsible for your school. You're not responsible for the state. You're not responsible for the county, for the school district. You're responsible for BCMCS and for the 200 students that you have. So, I think, we keep referring to this data, but there is data outside of Bucks County and Pennsylvania and even the US that clearly states that masking children is unnecessary. And whether that's Sweden or the UK, plenty of other countries have never masked kindergarten through 6th grade, elementary age kids. And there is no data supporting it in those countries that they had humongous outbreaks because of it. So, it's just so frustrating to hear this, well, the CDC says. They've been wrong plenty of times in the course of the last 18 months, but we continue to defer to them because nobody wants to be the one that actually has to make the decision. And I think and so the kids suffer because the adults are scared. And that's the frustrating part.
Thank you, Wayne.
Thank you.
I see next, Joanne. Any comment?
Sure. I didn't actually want to state something live. I just want to make it clear that doing it weekly is not only going to be difficult for students who are 5 and 6 years old, changing it on a flip of a dime, but also changing the notion literally Sunday night potentially, or whenever you decide to have your weekly meetings or whenever that will be. That is just physically impossible to me as a teacher to state to children that it's going to be changing every week. Every week we'll be changing this. That is not appropriate for children at this point. We need to at least do it at monthly, if not the entire marking period, like Tony had suggested in the beginning of this meeting. We need to do it at least monthly, at least get kids acclimated to a change that's going to occur. We have many students with special needs at our school that are not able to just change on a flip of a dime like that. Unfortunately, we don't have that ability to do so. We are an inclusive environment, and it is not fair to our students to be able to just automatically change one way to another. That's not how our schedule is going to be changing. That's not how anything else is going to be changing except for this masking. Masking has been extremely beneficial in the fact that I haven't even gotten sick this year. Like, as in general, I haven't gotten sick. I've gotten sick every single year that I've taught, except for this year. It has not only been a good thing for, keeping COVID out of our school, but also keeping other illnesses as well. So I just want to, if we are going to go with Plan B, please do so in a monthly manner, just so that it's more manageable for teachers, staff, and students to be able to make those changes and get ready for those changes in advance. Many of our students need that. So thank you for letting me speak.
Joanne made a point about absences. I'll say that last year, staff absences were dramatically less for illness than in previous years. I don't know whether that's attributed to masks or not. But...
Okay.
Great feedback.
Thank you. There is Ian is next on the list if you wish to speak.
Yes, can everybody hear me?
Yes, you may need to turn it up just a little bit.
Hey, here, I took out my headphones. Can you hear me better over this camera?
Can hear you clearly. It's just still a little low.
Yeah.
Well, then I will lean in so you can hear me.
Better.
So I posted my data document. I appreciate the discussion of data. I appreciate these parents being here concerned for their children and you board for listening to these concerns. So first I want to just thank you for that. I don't know, Al, since you're doing the screen sharing, if you could bring up that data, that would be awesome that we could look at. Otherwise, I do encourage in the chat, you can download that PDF that I'm looking at. And, there's a lot of talk about data, but right now the data is, you're making the case, we need data to not mask. I would ask the question, we need data to mask. What data do we have that masking is effective? Because the data that we point at and that I have in my presentation, pretty clearly shows that children, in particular school children, are not impacted by COVID dramatically. And I appreciate the concerns that others have raised about immunocompromised children. Of course, that would be an exception, as well as immunocompromised people at home. But the school cannot make decisions to protect people's family members at home. The school needs to make decisions for the health of the school and of the children present at the school. And we know that children learn better when they're able to see people enunciate, when they are not having carbon monoxide completely recycled into their face, especially small children who can't wear masks particularly appropriately anyway, if we're being honest, to actual N95 masking, for example. So if you scroll down, I mean, this slide, I was just pointing out that out of a country of 74 million, there have been 361 children deaths, right? When CDC Director Walensky, if you scroll back up to that second page, Al, said there was a troubling rise in adolescent hospitalizations. I don't know if you see that under 18 at the start of June there was no visible rise. I don't know where she's getting that data, but that's the data the CDC provided. That chart is from the CDC. And so when people say just listen to the CDC's recommendations, I question that. I want to see the underlying data before we make a decision. If you scroll down another page, you can see Pennsylvania with about 12.8 million people. In the top right, the new cases per day. Happily, that arc is going lower and lower as vaccinations have rolled out. As we go on to the next page, you can see that I put some numbers in there to help out. There are literally 0 deaths for children under 10, and children under 17, there are 17 deaths. So who are we protecting with these masks if literally 17 children in the population of, if you go down to the next slide, cases, you can see between 0 to 9 and 10 to 19, there have been approximately 190,000 cases among school-aged children. 17 deaths. That's less than 1 in 100,000. So who are we protecting? We're not protecting the children because clearly they're not at risk. I can understand the appeal to protect adults, but adults can be vaccinated. I'm vaccinated. It's great. You know, it helps protect us. The vaccines are thoroughly durable. They help keep us safe. And on top of that, we can still wear masks. I think parents should have the decision. If they want to send to their children to the school masked, that's on them. That's great. They have that choice as a parent. But to mandate masks, I don't think the data backs that up. If we scroll down another page, you can see Bucks County specifically, 630,000. And that red line in the top right is the cumulative cases. I'm not seeing a dramatic rise there, right? It's a slow tick up as the Delta has emerged, yes. And as you see, cumulative deaths happily have leveled off. There's not been a lot of death, as we see on this next slide. Out of the 1,339 Bucks County COVID deaths since the beginning of last year, we're talking about 18 months. There have been 12 in the past 2 months. This is not telling a tale of a dramatic rise in cases, of a fearful Delta variant tearing across our community. No, there have been 12 in 2 months. Look at those last charts, they barely register. That means the vaccines are doing great work, and I encourage everyone who is able to consult with their doctor and get those vaccines, and children are not dying from this disease, which is a wonderful blessing. If we move on to the next slide there, we can compare it with something that was far more deadly to children, in particular swine flu. Going back to 2010, there were 7,000 roughly less infections and almost 4 times as many deaths. But I'm not aware of any schools that shut down or masked or pursued any such policies in the midst of the swine flu that was definitely hot in parts of our nation at the time. And so if we scroll down another one, it's probably too long than I have time for, and I don't want to take up people's time, but there was an article posted on the 20th here in New York Magazine talking about the science of masking kids. And so I'll just read the highlighted portions because I have the link there in the PDF file. I encourage everyone to read it. It's about 3,000 words long and really made me think a lot. But they mentioned distancing, hybrid models, classroom barriers, HEPA filters, and most notably requiring student masking were each found to not have a statistically significant benefit. In other words, these measures could not be said to be effective. They may make us feel good like we're doing something to combat the virus, but a particularly virulent contagion, it may just be smoke and mirrors to make ourselves feel better as adults. If we move on to the next page, you can see we've got some reputable scientists chiming in, and more importantly, a point that Brian raised, many of America's peer nations around the world, the UK, Ireland, all of Scandinavia, France, the Netherlands, Switzerland, and Italy have exempted kids with varying age cutoffs from wearing masks in classrooms. Conspicuously, there's no evidence of more outbreaks in schools in those countries relative to schools in the US, where the solid majority of kids wore masks for an entire academic year and may do so, particularly if we go with something like Plan B. You can scroll down the next page since we're just hitting the highlights of these excerpts. Again, the article is much longer. I didn't post it all here. But a masking requirement of students failed to show independent benefit is a finding of consequence and great interest, says Vinod Prasad, an associate professor of University of California, San Francisco Department of Epidemiology and Biostatistics. It should have been included in the summary. So that's referring to the CDC study that was done. And they chose not to include the conclusion that the masking didn't actually help out. They left that out conspicuously, which seems less than intellectually honest, if you ask my opinion. I won't go into these next slides because I've already taken a lot of time, but my question basically boils down to this. We keep saying, oh, we need data to prove that masking needs to be, or can be stopped. I want data to prove that masking should be promoted, and I'm not getting it. And what I do know is that children learn better when they're unmasked, that children need to see people's faces, particularly young children, to develop. And I know that, for example, the American Academy of Pediatrics posted an article before the pandemic started emphasizing the need to have FaceTime with your children, particularly young infants, to help them cognitively develop and to develop communication skills. And then they conspicuously removed that article once the pandemic started. Why would they do such a thing? It's not like children have changed and that they don't need to see our faces any longer. And all of this I try to say with the utmost care and love, again, gratitude for all these caring parents and all the children who want to do their best to learn. But I'm not seeing the data to promote it. And I wanted to just bring that to the forefront. Thank you for your time.
All right, thank you.
Thank you.
I know another individual is Jenna Harris. No? Okay. And Jill.
You skipped over Cobb,
Who?
Aaron Cobb.
I don't have that one. Mine goes right from Jenna Harris to Jill. I don't know why. That's the next name right after Jenna. For me, what I'm looking at. But if they're ahead and they wish something to say, then.
Well, it was up before, like they kind of, it was Wayne, Ian, and then Aaron Cobb.
Right.
Are they still there?
I just don't see anything in the chat.
And then
Why don't you just ask that if anyone else wants to comment to speak up?
Kristen Cox.
I guess that would
Yes,
be.
thanks. I'd like to
Okay.
speak, but I'm happy to wait my turn. I think my name is last.
Oh, now all of a sudden I see. Well, just hold 1 second. Aaron, is there something you wish to add?
I do. Thank you. I appreciate you guys opening this back up for the parents. I want to know, we have a severely immunocompromised father, 2 kids. How does the school plan to support the parents' choice if they do want their children masked, if they go to Plan A?
Say that again.
So we plan on having our children masked,
Okay.
no matter what.
Right.
Summer camp all summer, unmasked. They were predominantly outdoors, which was our reasoning for that. At this point, knowing that my children will be in close encounters with 25 odd kids, that's 25 different families. How will the school promote and reinforce if a parent says, I want my child masked?
Well, that's what was in the in Plan A. It specifically stated that if that's your wish, you're to email info@BCMCS, and then we would have a database, and that would be a shared folder that we would have with the whole school, and all the staff would know whose parents are wishing for the masking or wishing for the optional.
Okay. And I apologize for the beginning part of the meeting. I was caught. But I appreciate that. I mean, I look at all the data. we're concerned, obviously. My kids were there in person last year. I know there were families that were COVID that didn't necessarily bring it to the school's attention, home or whatnot. So I think there are a lot of concerns. Obviously, it's right up to the deadline. So I appreciate you guys for bumping this meeting up. I will make a comment. I think another parent said something about the Pennsylvania schools, whoever the directing group that is, just changed it 2 days ago, right before school opens up. Most public schools don't open for another week and a half. So,
Right.
I mean, for you guys, it stinks.
Yeah, it was a quick turnaround.
But right now, it's obviously it's something you have to jump on. But yeah, I mean, I think realistically, I'd prefer a month or longer, like Ms. Kura said. Other than that, I thank you for your time.
All right. Thank you, Erin. And I believe next one it would be Kristen, is it? Anyone else?
I think Kristen Cox is.
I'm happy to speak if it's my turn.
Yeah, I at this point, I believe it would be you, Kristen, since you were on before, and then we had Erin just pop in ahead of you.
Great, thank you so much, and thanks to all for coming together today to really try and solve this, get a good outcome. Just to say that I really genuinely sympathize with Ian and appreciate your energy and your dedication to putting together that presentation. But I also want to say, as a public health professional, I just want to make it very clear that I understand that masking is a controversial issue in the public sphere. It's actually not very controversial in the public health community. So we have here a pretty firm consensus with the CDC, the American Academy of Pediatrics, the state, now even the county, really aligning on a recommendation. And we have the majority of parents having voted for that recommendation. So it seems to me that there's not a lot of additional discussion needed, that we have alignment across both the authorities that we're looking at and the parents at the school. So I guess I would just like to say, I think, that should tell us that option B is strongly preferred. And that, if a change needs to be made, then, that's something that should be done with ample notification to all families, because understanding that all families have different circumstances. Thanks very much.
Okay.
Thank you.
At this point, I don't see any more names on my chat.
I didn't see any more either.
Okay.
So then let's reiterate what the motion is.
I make a motion first that we close public comment.
Good point.
All those in favor?
Aye.
Aye.
Unanimous. Public comment closed. And then what was your question again, Tony? Sorry about that.
What is the motion that you'll be voting on?
A motion for Plan B with said changes from last try. We have that. We need to reiterate the language we want to put in now, or is that going to be inserted in this one? So since
I don't know. Did public comment sway how you want to? Do you want to have the motion as is, or do you want to change it to what Ray said?
I think we can evaluate. I agree with the young lady that said it will be difficult for younger children to make adjustments, and I agree with that. And that's was one of my concerns. But before we get there, I think we have to go through the process for discussion. So let's go through. I'd like to make a motion for Plan B, and then we can open discussion to make any changes necessary.
Okay. Anyone want to second the motion?
He already made the motion, so we just have
Okay.
to
So
table it.
now it's
Tabled.
It's untabled now.
Okay.
right.
and then we
Untable.
discuss it. Do we motion to untable it, or
Yes.
I'll make a motion to untable Jeff's motion?
Second?
I'll second.
Okay, we're now untabled and back on the table.
Okay, let me just catch up with you. So it was tabled, there was public comment, was reopened, public comment was closed, and we just, who just untabled? Debbie?
Debbie untabled.
Jeff seconded it.
And I second.
Got you.
Well, so since are we in discussion now?
Yes.
So I agree that making adjustments it could be disruptive. I'm okay with, I believe the guidance or the information that we received regarding on a monthly basis for me is acceptable. I think maybe we should still evaluate and understand what the data is so that when we do come into a meeting at that milestone during the monthly period, we'll have the information. So I'm okay if we change it to review on a weekly basis, as well as making any necessary changes on a monthly basis, something along those lines, if that would be satisfactory.
I mean, the way you have it now is as needed. The board convenes every month.
True.
You could keep this you could adopt it and then just under old business, just revisit it every month. And if there's no motion to change anything, you don't make a motion. If there's a motion to change something, then a motion.
Make a motion.
I think that the people are basically stating that if we change something and it's at a board meeting, say it's like the October board meeting, they don't want the next Monday for that to start, or that's a Wednesday, then Thursday you'd have
Right,
math
right.
off. So I think that they're asking for at least some time so that if they choose not to keep their child going to the school, they have option. They can figure out what the options are at that moment's notice.
That's one of the reasons why I originally recommended for the marking period.
Right.
Because then, you have an October meeting, and if you change it for the second marking period, there's like 2 weeks, 3 weeks before the second marking period comes.
As always, Tony, you're 3 or 4 steps ahead of me, so I agree with that. I see why you're saying that now.
Right.
I believe Pennsbury adopted not that we follow them, but I believe they did theirs for the first marking.
There's really only 4 days before the marking period ends. From the board.
Yeah, if it's October 27th, the marking period is November 1st.
Right.
So maybe the meeting prior, the prior month or something of that nature.
Or at least if you vote something.
As needed.
Right.
As needed,
I just think if there's a change, you can give them like 2 weeks before you would make that change.
I mean,
what is the real issue here? If
there's a change,
if the data supports that it's somehow miraculously found out that masks are unnecessary, and a recommendation is that you don't have to wear them anymore, and yet some people will feel strongly about continuing to wear a mask, there's nothing stopping them from doing that.
Right.
There's
Right.
nothing's going to change about the cleanliness protocols. I think the social distancing is something that of course, that we should stick with, but we're talking about here visiting this on a regular basis. I don't like the as needed language. I get it. I think it's fine. I think it leaves a lot of leeway and for us to be nimble and flexible, and I think that's great. Okay. If someone feels strongly about wearing a mask for their reasons, as if the one woman very articulately said that the grandparents are in the home and they're at risk, Well, certainly, you know, her children could continue to wear masks, you know, and they can certainly weigh their options, you know. I mean, so we're talking about, you know, I think Ms. Gagora said that, you know, changing on a weekly basis is not feasible. And I'm paraphrasing, I think, you know, what we're talking about is being very flexible, and for people who want the masks off the kids for their reasons, their kids can come to school without a mask. I don't think we should be waiting for a marking period. I don't know. And somebody, you know, clear it up for me. What would be the big difference if someone decided that or we removed the mask mandate and they came into school without a mask, and you know, and someone feels strongly about continuing to wear a mask, and they're interpreting the data in a very important, in a way that's important to them, that they can continue to wear a mask.
Why don't you just change the wording?
I don't, you know, again, my reason for asking for the motion to be amended was that we are driven of the mindset that we want to be as flexible as possible.
You want to change the motion to, instead of as needed, to on a regular basis? Revisiting the mask policy on a regular basis.
I don't even know why, you know, we're doing the word salad here. If you want to leave it as needed, hell, let's have a vote. I'm voting no. Okay? And you know, I'm voting no. As needed is for me personally is too vague. Too vague. So
do you want to offer your suggestion as how you want it written?
I've already suggested it. Okay, but what's getting misinterpreted here is that necessarily absolutely guarantees that if we visit this on a weekly basis in some sort of formal manner, that we'll be changing the policy.
All right, and that's not your point.
That's not the case, nor the intention.
I didn't think that it was either.
No, that's not your point. It's just to be proactive and ahead of it.
You know, no, that's not. That's
So
not.
then, so
I
go back.
understood that as well.
So I think we all did. I don't think that's raising tension. So is it going back to changing, taking out as needed to a weekly basis? We are reviewing, you know, revisiting the mask and face covering data on a weekly basis and adjusting, you know, guided by the recommendation, blah, 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 blah. And then we put something in there. Then a month, you know, add something in around by the end of the marking period, we'll make any adjustments as necessary.
Adjustments in the policy. So why don't we put in something then, if the data or information and recommendations that we are receiving
warrant a change.
That may warrant a change in our policy. Thank you, Deb. Okay. That we will call a special meeting.
I like that.
Does that?
I think that's good.
Make sense that we'll call a special meeting within 48 hours.
During softball? No.
Wise lady.
Okay,
My
so
God.
I just want to make sure we're all on the same page. So what you want to do is that last bullet point.
School commits to revisiting its mask/face covering policy.
Data
as needed, and on a weekly basis, and any board member can ask for a special meeting to revisit the issue.
So adoption of Plan B with the understanding that this matter could be revisited based on, tell me what you want.
I think the requirement for a special meeting could go in. Leave as needed with
If reports warrant a change, then a special meeting can be called.
within a 48-hour period. That give everybody enough time. I know Jeff travels. You know, my availability is generally good, you know, but can change. However we want to word this.
Yeah, I'm working on it right now.
Thank you, Tony.
And if the data warrants the board's further review,
that we need to look at this hard and always.
A special meeting can be called within 48 hours. Okay, let me read this back to you. Motion to adopt Plan B with the understanding that the school commits to revisiting its policy as needed, and if data warrants the board's further review, a special meeting can be called within 48 hours.
I think that's acceptable language to me.
I think that's good. That's why you're the wordsmith, Tony.
Well, the only thing I would like to add to that, or to make sure it's data, where's that data coming from? Are we still going to use the local state health stuff? Because I don't want to be because data's coming from everywhere. I'm not saying, you know.
Well, why don't you could change it to adoption of Plan B with the understanding the school commits to revisiting its policy as needed, and if recommendations
of the local and state departments of health and in conjunction with the recent data, in addition, directed by the Bucks County Health Department.
Yes.
That's done. And I'm not sure if you want to put school district in there also, but I don't want, you know, not that there's, we can get every opinion on either side of this argument. And I just don't want to be, I want it to be on a guidance from local and state Department of Health.
Mm-hmm.
Yes. Okay, I'll read it one more time. Motion to adopt, here, hold on. Okay, motion to adopt Plan B with the understanding that the school commits to revisiting its policy as needed, and if recommendations of local and state departments warrant the board's further review, a special meeting can be called within 48 hours.
Sounds good.
Right?
Yeah.
Yeah.
That's language
No, I accept that language. I think that's a good step, good compromise, or at least good clarification, excuse me. How about, do we need anything in there about the marking period and when change? So we convene 48 hours afterwards, and then to follow the guidance and recommendation. What about changes to policy? When would they be enacted?
I think that would be part of the special meeting.
Yeah, I think if you have a special meeting, you could just, you're not saying in this motion.
Right, we're not
it's
saying
for the
how
school year, for 2 marking periods, 1 marking period. You're just saying it's in effect until recommendations from the state and local government would prompt you to make a change.
And the change would have to be voted on. So it wouldn't be.
Absolutely. And it would have to be in a public meeting where you'd have public comment and so forth.
Okay. Okay.
So, Jeff, you made that motion?
I did.
And Debbie, do you stick to the second that you made
Yeah.
earlier?
With the adjustments.
Okay. Any further I'm sorry.
No, any further discussion? It's okay.
Old habits.
That's any further discussions?
No.
All right, then. All those in favor in how the wording has been amended and Plan B as well?
Aye.
Okay. Unanimous. At this point, then, I guess we're at the conclusion of the meeting.
I'll make that motion.
Anybody want to second it?
I'll second.
Okay. Our meeting is adjourned.
Thank you, everyone.
Hey, no,
Thank
thank
you,
you. Great
everybody.
job, everybody.